so this is my central line dressing video. So the first thing that you always want to do is grab your supplies. So we have our central line dressing kit, mask, and gloves. So then you want to enter the room. You want to advise who you are and what you're doing. So explain to them that you're doing a central line dressing cleaning. You always want to do 2 patient identifiers, so name and date of birth, and then you also want to check their wristband while they're stating it. You also want to ask if they have any allergies at this point, because of the swabs that are in the kit can cause them to have an allergic reaction. And then after you do all that, so you performed your hand hygiene, you want to go ahead and glove up. While you're doing this, you can explain to them that a central dressing needs to be changed about every 7 days. If it becomes soiled or if the band-aid starts to come off, they're going to want to change that immediately. After you put your gloves on, you want to mask up everybody who's in the room. So yourself, the patient, so you would advise the patient to turn their head away from the centralized dressing and then put a mask on them. And then anybody else who's in the room, so if they have visitors, you also want to put a mask on them as well. So you mask up, you're going to inspect and palpate the site. So for this reason, I went ahead and just taped a centralized dressing on this. I'm not going to remove the tape because obviously it'll remove the line. But so you're inspecting for any swellingness, you're going to palpate for tenderness, anything like that. I don't have a Tegaderm patch on this, but if I did, I would kind of just anchor my hands near the site and then I would pull it towards the insertion site. And then I would remove that and dispose of that, and I would take off the bio patch. Again, I don't have one of those, but I would take the bio patch off. And then the last thing that you want to do is go ahead and measure the insertion site from the port all the way through, and you're matching it up with the previous nurse's measurements to see if it's migrated at all. So after you do all that, you'll go ahead and deglove, you'll perform hand hygiene again, and then you'll go ahead and open up your kit. So this is a sterile kit, so you never want to cross-contaminate anything. So you'll take your sterile gloves out. It has a 2-inch parameter that you can touch. That's considered to be not sterile. So you will put your sterile gloves on. Which is always a lot easier said than done. Okay, so I'm sterile. I can grab the middle of this because it is sterile. Disregard it. Alright, so I'm sterile. So right now we're going to go ahead and clean the site. So you would just use an alcohol swab. I'm not going to open it, but you would take it out and then you would clean in a circular motion for 30 seconds, going bigger and bigger around the site. And then after you're done with that, you'll want to clean underneath this too, but you want to make sure that you're not pulling the central line because you can dislodge it. You also don't want to pull it the opposite way for the same reason. So once you clean it for 30 seconds, you can get rid of that. Then you will take your CHG swab and you'll activate it by pushing down on these 2 clamps. And you'll clean this in a back and forth type of way. So again, you're lifting the line, you're cleaning back and forth, all around. If you had a second one of these, you could use it to clean the line. I don't have a second one, so you would just start from the insertion site and go up, cleaning the entire line. And then that is done. So from here, you would go ahead and let this air dry. And as it's air drying, you can take your skin prep and you would put it where you're gonna put the Band-Aid at. So you just go kind of around in a square around the central line dressing, and you would do that. You'd go ahead and, I don't have a new bio patch in here, or maybe I do. It's this. So you would put a new bio patch on, just like that. And then you would take your Tegaderm, you would peel it off, you would apply new Tegaderm, just like that, and then you peel off this part. You want to push down all the way, making sure that there's no bubbles or anything, and then you always want to put your initials, time, and date that you did the patch so that they know when to change it next. So you'd put that on there, just at the bottom. And then the last thing that you want to do is go ahead and tape the central line to the actual patient so that it's not moving around. Tape and gloves are the worst. Okay. So you would just tape that up towards their neck or wherever it's at. And that is your centralized dressing. You would go ahead and dispose of everything. You could take this off, and that's it.